I am Dr. Rekha Gogi. I am an obstetrician and gynecologist practicing at Malleshwaram, Bangalore. Greetings from Cloudnine Hospital, Malleshwaram, Bangalore. I am today going to be addressing a very common issue which pregnant couples face, and I get asked a lot of times about this question in my clinical practice. Doctor, are you going to induce me? And if you induce me, are you going to do a C-section? The commonest fear, if I can use the word, among couples is that a doctor will not even try for a normal labor and she will straight away do a cesarean section. So the connection between inducing labor and C-section is very strong and rightfully slow. So we are going to discuss about why would I induce. International recommendation for induction of labor is for any woman who has crossed the expected date of delivery, that is 40 weeks or 41 weeks and 3 days. Going to 42 weeks is a little risky, so most international recommendations want us to induce you at 39 weeks because the morbidity, mortality both for the infant and the mother is significantly less if the induction happens at 39 weeks. What is induction of labor? If you haven't gone into labor even by 39 plus weeks in your pregnancy, then the doctor will offer you to induce the labor. Induction can be at the beginning 2 or 3 things. First is if you think the uterus is a balloon shaped organ and the mouth of the uterus is tightly closed, rightfully so because it has to hold the pregnancy for 9 months. This cervix has to dilate slowly, it has to become soft and it has to come to the center so that it opens up. This is called as cervical dilatation and effacement. So we have to have a ripe cervix. So the first part of induction is to ripen the cervix. To ripen the cervix, we need to use some chemicals which are naturally produced in the body, which begets a normal onset of labor, if not by induction and ripening. So cervical ripening is the first part of induction where we use chemicals called as prostaglandins which are applied to the mouth of the cervix. This ripens the cervix, makes it soft and takes it up. After that, if the cervix has ripened and it's become soft, then we can use other tablets and injections. The tablets are called as misoprostol, which was actually originally used for other reasons. When they used it for other reasons, they started noticing in female subjects that if they were pregnant, then they were going into labor and having onset of contractions. So it was actually originally in the history used as a combination with an abortion pill called as mifepristone. So they used to use the mifepristone to stop the pregnancy from growing and misoprostol to open the mouth of the uterus so that the abortus comes out. So that way the history is there, and they have started using this tablet misoprostol either orally or vaginally to be introduced once the cervix is ripe so that it opens up and it dilates and you go into labor. The other drug which is commonly used is called as oxytocin. It is used as an injectable and you are put on a drip so that you get contractions, and that also helps in cervix dilating. There are other things called as intracervical Foley's catheter installation, where the Foley's bulb, the Foley's catheter is introduced right inside the uterus and the bulb is dilated and it is pulled so that the pressure of the bulb opens the cervix. So basically induction means to soften, ripen and make the cervix deliverable. So actually when a doctor is offering you a cervical dilatation or an induction of labor, she's actually increasing your chances of a vaginal delivery at 39 weeks because the baby has already been formed fully and it's ready to come out. There is nothing magical or there is no magic happening on the date given to you for delivery. That is actually a sign or an alarm date for us that now the baby has to come out. That's why we call it as estimated date of delivery. So typically what will happen is once you agreed with the doctor that you want to go in for a induction of labor, you're admitted on the day before, consent forms are taken, you have been explained and you are willing to undergo. Then the night before you are admitted, and we either use various methods which I have explained to you right now, and you are left in the hospital under a very good care in the labor room for watching you overnight and the babies. all the action actually happens the next day morning, when we actually use the second dose of either a same medication or a different medication or a combination of the gel, of the tablet, on the drip, to make sure that the labor progresses well. Once the labor progresses well, then we augment it so that we bring about the delivery within the next day evening. So it is like this, that I cannot offer you an induction, and if it doesn't work, then I say, okay, let's go home, let's see you tomorrow. It doesn't work that way. Once I induce you, then I'm committed to deliver and get the baby out. So the induction to delivery interval for most women and most doctors will be anywhere between 24 hours to 48 hours. We don't want a laboring woman to be in pain for more than 24 to 48 hours. Most of the times, if the baby is too big and the cervix is very stubborn, it does not open, we try multiple times, it does not open, then we do have a counseling session right before the induction, that you may end up with a C-section for various reasons. So failure to progress, failure to induce are all reasons why we would do a cesarean. Also, while in the process of induction, if the baby's heart goes down or the mother's condition is not good, that we can wait, then we will not wait. There are reasons for induction which are medical and which are social, and of course there is a preterm postterm indication also. Most medical reasons will be the mother has to have the delivery now and the pregnancy is causing trouble to her, maybe like hypertension or baby is too small. So those reasons. Social reasons are not a good recommendation, where you see the date and the time and say you want to go into labor. I would not recommend that to you. So induction gives you a better chance at 39 weeks of having a successful vaginal birth. Failure of induction is a common problem. So the later you wait for induction, the better are the chances that you'll have a vaginal birth. If the induction does not work, failure to induce, then you go into a cesarean section. Talk to your doctor about induction and the method of delivery you want right in the beginning. Thank you.